COVID cases and hospitalizations both declined across Ohio over the last 24 hours. 19,697 new cases reported, which is below the state's 21-day average, and 476 new hospitalizations.
And there's new information today from the CDC that shows seniors who haven't been vaccinated are nearly 50 times more likely to be hospitalized compared to those who have been vaccinated and boosted. Emma Henderson explains why.
COVID-19 has been detected in the United States for more than 2 years. Vaccines have been available for about a year for our senior and elderly population, and studies show just how much they help.
Because of them being at much higher risk, that means also that the vaccine will be the best or the most protective in that group.
New reports from the CDC show elderly patients who are vaccinated and boosted are 49 times less likely to be hospitalized with COVID than those who are unvaccinated. And infectious disease specialist and geriatrician Dr. Elie Saade says the lasting impacts of COVID are also hitting this population hard, especially those with pre-existing conditions.
Someone who was independent, for example, can become dependent, and not just because of the lung disease, but because of everything else going on. They can become dependent on others, and frequently that is irreversible.
So where does our area sit as far as vaccination rates for people 65 and older? Ohio tracks people who have finished their vaccine process, but counts boosters differently. The statewide average for completed vaccination sits at about 80% for each age group above 65. And that statistic remains true when broken down into Cuyahoga, Lake, and Summit counties. And we know a majority of those have also had a booster shot. But Saade says it's important for anyone who spends time around this vulnerable population to protect themselves in the same way.
Getting the vaccine and getting boosted will not only protect the person who's vaccinated or boosted, but will also protect those around them.
Another thing Dr. Saade highlighted is that COVID can manifest differently in people over 65. They might not get those milder symptoms like a fever first. They could jump to having issues with breathing, heart issues, and even blood clots before it's clear that they've even been infected. Jay?
All right, Emma Henderson live from our newsroom. Emma, thank you.